here
All right.
at LifeQuest, so no pressure, and we're just glad to have you.
Yeah, I'm glad to be here. It's
Good.
always a good experience.
Okay. So let's go on. Did you make him co-host?
So
All
should I
right.
try and share my screen now?
Yes, sir. You certainly may.
Okay, it is 10 and we have a few folks coming in, but while our guest is getting set up, I wanted to give a welcome, and I'm going to have to read a little bit because he has a lot of experience to share, and I want you to know about him. This is Dr. Andre Paixao. He can correct me in a moment, but he is with Arkansas Heart Hospital. Arkansas Hospital, we're so proud of our partnership with them as one of our lead sponsors for LifeQuest. They have, some sponsors just put their logo up, but this hospital has presented many times to LifeQuest, including our guest today, in classes and in important information to our members. So we're glad to have our partnership with Arkansas Heart Hospital. Our guest today, Dr. Andre Paixao, is a cardiologist from Arkansas Heart Hospital. He's born in Brazil, but did his residency at Georgetown University in Washington, D.C., followed by a cardiovascular disease fellowship at the University of Texas at Southwestern Medical Center, and then additional fellowship in interventional cardiology from Emory University. He is a renowned researcher, has published many, many articles in such journals as the New England Journal of Medicine and the American Medical Association Journal. We are so thrilled that you're here with us today, that your family, your wife, your son, and twin daughters, that must be exciting, have relocated to Little Rock, Arkansas, and that you are with us today to take your time out of your busy schedule to talk to LifeQuest. Welcome.
Thank you. Thanks for the introduction. Um, can you guys see my screen?
Give a thumbs up. Joe can. Yes, we can.
All right. So I'm a preventive and interventional cardiologist. So I spend a lot of my time doing procedures as far as fixing blockages in arteries, fixing heart valves, and fixing problems in circulation to the legs. But I tend to focus a lot of my attention, both in clinical practice and in research, in preventing the diseases that I actually end up having to treat later on. The more effective way of treating cardiovascular disease, and most diseases for that matter, is to prevent it in the first place. So we're going to spend a lot of time here talking about what the most common diseases of the cardiovascular system are, what signs and symptoms to look out for, but also, and perhaps more importantly, how to prevent them. Usually I'll encourage people to ask questions as we go along, but given the format of the talk today, I guess it's better to hold them until the end, right? So here we go. First, a very brief introduction to the cardiovascular system. Basically, the heart is the central pump that's in charge of carrying blood throughout the body. If you start with the blood without oxygen on the right side of the heart, it needs to be pushed to the lungs. It receives oxygen there. It gets routed back to the heart. Then the main pumping chamber of the heart, which is the left ventricle, pushes that heart through arteries to the rest of the body. Those are the arteries that can develop blockages. The veins have to carry that blood back up to the right side of the heart so it can be circulated to the lungs, and then the cycle continues. Any part of this system can develop problems. You can have problems with the pump, that's the heart itself. That problem can be from the heart muscle, it can be from the valves inside the heart. You can have problems in the arteries, you can have problems in the lungs, and you can have problems in the veins. So we're just going to try to touch on the main and more common conditions that can affect the average person. So perhaps the most common and most thought of when it comes to heart disease is coronary artery disease. And that's usually cholesterol and inflammation buildup in the arteries of the heart. These arteries primarily supply the pumping chamber of the heart, which is the more muscular part of the heart. Uh, we're going to go over the possible consequences of those blockages, but they mostly involve a heart attack or angina, which is chest pain that comes from one of those blockages. Now, the second image here is of the valves inside the heart. The heart has 4 valves. Any one of those valves can become blocked, meaning it doesn't open well, or it can become insufficient or leaky, meaning it doesn't close effectively, so some blood flows in the wrong direction. When we say a leaky heart valve, a lot of people seem to think that the blood is leaking outside the heart or someplace else. That's not the case. It just leaks back, so the pumping process becomes less effective. Congestive heart failure is a problem with the pump itself, with the engine. You can have congestive heart failure from a stiff heart muscle, meaning the heart muscle doesn't relax to take blood in, or you can have congestive heart failure from a weak heart muscle. The heart becomes incapable of pumping, of squeezing that blood out effectively. For that pump to run, you need an electrical system telling it to beat and making it beat in synchrony. And if you have problems with that part of the heart, you can develop arrhythmias, which can be a fast type of arrhythmia and palpitations, fast heartbeats, or you can have inability to generate enough heartbeats per minute. And if that's the case, people generally need a pacemaker. All right. So why does it matter? Well, cardiovascular disease is still the #1 cause of death in this country, even though it's declining, and other causes like cancer are on the increase. The combination of heart disease and stroke still by far the #1 cause of death in the United States. The cardiovascular causes in this group, in this slide, are grouped by these 3 colors here. And you can say that irrespective of the age group, it's still the #1 cause of death. So Arkansas is a specifically bad place when it comes to cardiovascular statistics. These 5 states here that are in blue are the states with the worst numbers in terms of cardiovascular deaths from strokes and heart attacks. So there's a lot of work to be done here. So let's start with coronary artery disease. So heart attacks, angina, the type of conditions that often are treated with stents or bypass surgery. So it starts off with some inflammation in the wall of the arteries, which are the blood vessels that carry blood to the heart muscle. That leads to the deposition of cholesterol inside the wall of those arteries. As inflammation grows and cholesterol deposition grows, that by itself can lead to a blockage, or that plaque can become unstable, rupture, a blood clot can develop on top of that, and that's basically what a heart attack is. So just another way of describing the same thing. Some people develop what we call stable coronary artery disease. So that slow buildup of cholesterol and inflammatory cells can lead to a blockage, which we'll now call a stable blockage. And when that's the case, most people will have angina. So every time they exert themselves, they walk, they go up a hill, they try to climb a flight of stairs, their heart will require more blood flow, more oxygen. And then because of the blockage, the heart will be deprived of that increased supply of oxygen and blood. In most instances, that will result in chest pain and sometimes just shortness of breath. So that's a relatively stable presentation of the process of plaque buildup in the arteries of the heart. Alternatively, people can develop a heart attack. And that's a different pathological process. In that case, the plaque is not necessarily what's causing the blockage. It's not what's impairing flow to the heart muscle. A heart attack usually starts with a cholesterol plaque rupturing. The contents of that plaque that's exposed to your blood. Your blood interprets that as an injury and tries to clot, imagining that you're sort of bleeding to death. You have a cut or something like that. As that clot develops inside of an artery in your heart, it completely blocks flow. then you can develop sudden chest pain, sudden nausea, or shortness of breath, and that's basically what a heart attack is. In that instance, the symptoms do not necessarily need to be worse with physical activity. Because it's a complete blockage, you can have chest pain even though you're not doing anything. So just going back to those symptoms, now that we know where they come from, most symptoms of stable heart disease will be worse with physical activity, so with exertion. They will include chest pain, which is usually in the central part of the chest. It's usually a pressure type pain. It usually lasts between 5 and 15 minutes, meaning if you're going up a hill, you stop, the pain should subside in 5 to 15 minutes. And it can often radiate or go to the inner part of the arm or to the jaw. That can be accompanied by shortness of breath, nausea, or diaphoresis, which just means breaking out in a cold sweat. A heart attack will have some of these same features, but it usually starts subtly, and it's usually not precipitated by increased physical activity. So that pain is again in the substernal area, which is in the middle of your chest. It's usually a pressure type pain. In this case, it will last more than 15 minutes because that blockage may not be resolved on its own. So the pain will not go away until that blockage ceases to exist. It can again radiate or go to the left arm and jaw. It can come with shortness of breath, nausea, and a cold sweat as the symptoms of a stable heart condition. If that happens, the right thing to do is to call 911. It's not to try to drive yourself to the hospital. So the mechanism through which a heart attack can result in sudden death is by triggering a bad heart rhythm. And if that's the case, you need to be shocked out of that bad heart rhythm. So the number one priority is to get to a place where they will be able to treat that fatal abnormal heart rhythm. So when the ambulance comes, even though they may not be able to open up the blockage right away, they can monitor you for this lethal arrhythmia, and if you go into it, they can shock you out of it. So let's talk about preventing heart disease. So the Framingham Heart Study was one of the first studies in the 40s and 50s to identify the main risk factors for heart disease. And to this date, we really have added very little to what they found out all those years ago. So the main things that contribute to someone's risk of a stroke or heart attack are elevated cholesterol levels, smoking, diabetes, elevated blood pressure, plus the risk is also higher in men and it goes up as we get older. How to prevent it? So there are a few things that have really strong scientific evidence behind it as far as them being able to prevent strokes and heart attacks. And that includes diet, exercise, good control of blood pressure, and certain cholesterol lowering medications. The diet that has the best scientific evidence in preventing heart disease is what we now call Mediterranean diet. It's based on olive oil, nuts, fruits, vegetables, whole grain products, fish, poultry, avoiding red meat, avoiding dairy products, and as part of that diet, it will be okay to have a glass of wine a day, preferably red wine. In 2 randomized studies, so studies in which the person had no control of what diet they were assigned to. So you basically flip a coin and decide this patient is going to have a Mediterranean diet, this patient is going to have a traditional low-fat diet. In these 2 studies, the Mediterranean diet resulted in a 30% lower risk of a stroke or heart attack when compared with a low-fat diet. As we talked about, these diets are based on those components, which are not that hard to integrate in a Western diet. The main thing that I want to sort of get your attention to is how much olive oil and nuts were in those diets. So these seem to be the main components to add, at least early on in that process. So in that later study, where patients were sort of randomized to different diets, the group that was getting olive oil, they were consuming about 1/4 of olive oil per week. And in the group that were consuming nuts, they were consuming 30 grams of nuts per day. Now let's switch gears to exercise. So exercise is perhaps the ideal medicine for heart disease. If you were to design a drug that fights all aspects that lead to heart disease, exercise would be it. Exercise reduces your blood pressure. It reduces the bad components of your cholesterol. It helps fight obesity. It reduces insulin resistance, so reduces your risk of diabetes and metabolic syndrome. And it also reduces inflammation. So it basically attacks everything that can lead to heart disease. This is a slide that I think is useful, though I'm not sure how much of it will translate. But here we're looking at 4 groups of people. In the red line, the group that has low fitness level. So these people do not exercise a lot. The blue line, people who exercise a moderate amount. And in green line, people who can exercise a lot. And the steeper the line, the more people are dying as they get older. So the people who are not fit, who do not exercise, are dying at a much higher rate than those who exercise at a moderate level and those who exercise a lot. Now we're combining that exercise intensity to risk factors like high cholesterol, diabetes, smoking, and all those things. And now the red line represents people who are not exercising and have a lot of risk factors. The other 2 lines are representing people who exercise a lot. And in the purple line, they have a lot of risk factors. And in the green line, they do not have a whole lot of risk factors. And what that's trying to convey is that even if you have a lot of risk factors, a bad family history, you're a man, you're getting older, if you're fit, if you're exercising at a high level, you can almost annul, you can almost get rid of all that risk that comes from other risk factors. We tend to really overestimate how hard we exercise. So in this study, we kind of asked patients how often they were meeting the exercise goals, and about half of them said yes. When we gave them a way to measure how much exercise they were actually getting, that number was less than 5%. So most people tend to overestimate how physically active they are. There are many ways to exercise. The traditional teaching is that we should get people to exercise for at least half an hour, 5 times a week, and exercise at a moderate level. So at least go out for a brisk walk with an incline for half an hour, or a jog on leveled ground. Nowadays, you can get a more sophisticated exercise prescription, and we know that if you do interval training, if you do more intense exercise followed by rest and repeat that process a few times, you can accomplish a similar amount of activity in a shorter period of time. But the way to do this is to sort of join a gym and not try to do it by yourself. You need some professional expertise to help in that process. Just sort of something to kind of test if you're exercising hard enough. If you can recite the Pledge of Allegiance while you're exercising, you're hard enough. This is an old slide from that same Framingham heart study that sort of goes over your risk based on your blood pressure. And it basically conveys that the lower your blood pressure is, the lower your risk is. And there's not necessarily a cutoff for that. As far as how low should someone's blood pressure be, that's a little controversial. We've been fairly consistent in what we call normal blood pressure. And normal blood pressure is a systolic or top number under 120 and a bottom number under 80. Doesn't mean that everybody can get to that point. The current recommendation is that people should have an average blood pressure below 130/80. Doesn't mean that it needs to be that way every single time you check it, but if you average it over the course of many weeks, your average number should be below 130/80. Now, smoking. So this is comparing the risk of people who smoke with the people who have never smoked. So the people who have never smoked have a risk of a heart attack that's 5 times lower than the people who smoke. And let's say you stop smoking now, it takes about 15 years for you to get back to that risk level. Doesn't mean it's not worth quitting smoking. It means you need to quit smoking right now so that you can collect those benefits 10 to 15 years down the line. The other thing that people tend to be surprised is by how strong of a risk factor smoking is. So in a minute, we're going to talk about medications. And the best medication to reduce the risk of a stroke or heart attack will reduce the risk of a stroke or heart attack by about 30%. The problem is smoking increases your risk of a stroke or a heart attack 500%. So if you're not willing to do that, then the battle is basically lost. Now, switching to medications, not everybody needs to be on a medication, but in many instances, your risk of having a side effect from a medication will be much lower than your risk of having a stroke or heart attack prevented by that medication. And statins, even though they get a pretty bad rap, and they're often blamed on a bunch of things that they really don't cause, but there's a very, very strong, consistent finding of lower risks for strokes and heart attacks in people who take statins. No class of medications has been more studied, and no class of medications had more consistent results. So there's no controversy in whether or not they prevent strokes and heart attacks. There's some controversy in when to start it. Does everybody need to be on them? Some people believe so. The more common teaching, or the more common train of thought, is that if your risk of a stroke or heart attack is over 7.5% over a 10-year period, then the benefit clearly outweigh the risks. And your doctor can help you determine that, of course. The main complaint of patients on statins is muscle aches and cramps. And it's a true finding. I mean, some people will have some discomfort while taking these medications. Having said that, a lot of that is actually in their minds and not actually in their bodies. So in trials where patients were not aware of what they were taking, very few, 1.5% to 5%, complained of muscle aches and cramps. In studies where people knew what they were getting, that incidence is much, much higher, 10 to 18%. And in a recent study, just including patients who had stopped their statins because they thought their muscles were hurting, 90% of them, when challenged not knowing what they were taking, had either the same symptoms taking a fake pill or had no symptoms taking the true statins. Doesn't mean that the symptoms are not real. They're real, but they can probably be overcome with sort of just reassurance and talking this over with your doctor. And sort of this is some of my information. I have clinics in Little Rock, Benton, Hot Springs, Nashville, and the Queen. Heart Hospital has clinics all throughout the state, and we'll be happy to help in any way we can. That's basically what I had to say.
Okay, thank you so much. This is a great time for us to ask questions. I'm going to pick on Joe. Joe Paulus had a comment that she wrote me in the chat. Would you like to share that, Joe, your comment and then your question?
Well, my comment was when you showed the map of the 5 southern states, we were all raised in the South on salt, fat, fried foods, sweets. I mean, that's just typical. It's the way we were raised, and that's why your incidences are higher, I think, in those areas. And my question is, aren't there different symptoms for a male having a heart attack than a female having a heart attack?
That's also a little controversial. So if you combine all the things we talked about, chest pain, shortness of breath, nausea, breaking out in the sweat, the combination of all those seems to be more common in men than in women. It doesn't mean a woman will have no symptoms. Maybe the pain won't be the more prominent part of her presentation. Maybe it'll be more shortness of breath. Maybe that pain won't necessarily go to the arm or the jaw. But if you're mindful of all those symptoms, you'll be very unlikely to miss a heart attack.
Right.
So if we're talking about avoiding heart disease in its early stages, mm-hmm. or stable blockage, any symptom that gets predictably worse with physical activity is worth telling your doctor. It's worth mm-hmm. having it looked at as a potential sign of a heart problem. If we're talking about a sudden heart attack, any symptom that starts suddenly and that involves shortness of breath, any tightness or discomfort in your chest, jaw, or arm is worth getting the attention of your doctor. And if we're including all of these things, we should catch most heart attacks in men and women.
Okay, thank you.
You're welcome.
Okay, this is our time our very privileged time to have a one-on-one with Dr. Paixao. So please raise your hand. This is a way to raise your hand as well as electronically if you have a question. Unmute yourself and ask away. Gina had a question about new treatments, new techniques for treatments. What's on the cutting edge right now, doctor?
So the more effective ways of treating heart disease is prevention. And that really hasn't changed much. It's diet, exercise, not smoking, in some instances, medications. Now we have a few alternatives to statins. There's a injectable class that seems to be effective. There are a couple pills that may be effective. But for most patients, the statin is the more effective way of preventing a stroke or heart attack. Once you have the disease, then there's a lot of new techniques. I mean, the stents that open blockages have gotten better. The techniques for bypass surgery have gotten better, and there are other things being studied. Chelation therapy has been put out there as a potential benefit, but if you focus on what we've learned in the 50s, we can cut deaths by heart disease in this country by more than half.
Okay, Emma has a question. Go ahead, Emma. You're unmuted. Share your question.
Thank you. I'm the wife of a heart patient. He's in his mid-70s. He is on medications, has good follow-up, has been to Cleveland Clinic multiple times, and I think we've done everything we can. But I want to know, besides keeping him fit and feeding him right, if he has a cardiac event, is there anything that I can do while I'm waiting for the ambulance?
I'm assuming he takes an aspirin, so you can give him an extra aspirin while you guys wait. And you can get training in CPR, in resuscitation measures. So if he stops breathing and loses a pulse, if you get training for it, you can provide chest compressions and potentially keep him alive while you guys wait for somebody to come in.
Do you know the best place for me to get that training after the pandemic is over? I don't go anywhere now.
That's a good point. Community services will post classes. Sometimes the Y will have classes. If you go to the American Heart Association website, they usually have a collection of places offering it, and there should be some local places offering it here.
Good idea. Thank you very much.
You're welcome.
Great question. Okay, Dave Bash, I believe you had a question. Can you let us see your face?
Well, I'll have to back up where David.
Okay. All
Gather.
right, go ahead. We can hear you. We can hear you. Go ahead.
Thank you, Leah, and thank you, Doctor, for an excellent presentation that we all, I think, benefit from. I did have one question about the diet. LifeQuest is offering currently what seems like a very valuable program advocating plant-based eating. And in addition, the Arkansas Wellness Forum run by Dr. Marielle also advocates just plant-based eating. And Dr. Greger, well known for health studies that seem to be well vetted, also advocates just solely plant-based eating. Would you say that this also could be a healthful way to reduce your risk for heart attack, providing it is healthy plant-based eating and not eating, of course, vegan junk food?
So a nutritional diet, nutritional science is unfortunately of mostly poor quality. There are very few studies that have followed a strict scientific methodology. There's some observational studies, meaning you just ask people what they eat and see how often they have heart attacks. And in those, a plant-based diet seems to be helpful. they're not definitive because people who follow a plant-based diet tend to do a lot of things different than people who follow a meat-eating diet. So it's hard to infer that it's the diet leading to the lower risk. That's why I mentioned the Mediterranean diet, because that's where the higher quality studies have documented a benefit. I think it's very unlikely that a plant-based diet is worse than a meat-based diet. I think if you're too restrictive, you're going to end up probably having a lot of patients not following it. If you can follow a plant-based diet, I think that's great. If you can add some olive oil and nuts to that diet, even better. But if you feel like you're more likely to stay on that diet if you eat fish or chicken every now and then, I would say go for it.
We have a question from Paul and then Aaron, but I also wanted to let our Facebook watchers know that if you're writing a question in the Facebook comments, we see you. So please go ahead and write those questions and we'll convey them to our guest speaker. Paul, would you like to ask your question?
Yes, two items. One, why is it that Oklahoma and Arkansas do have higher heart issues? Is it temperature? Is it diet?
It's
And
for
the second
sure
one
not
is-
temperature.
And it's not temperature.
Yeah,
And the second one, did I read that? Sorry.
It's probably behavioral. High rates of obesity, high rates of sedentary behavior, high rates of smoking.
And did I see that there is in the Mediterranean diet, one of the tests was 1 liter of olive oil per week?
He is similar to that, one quart. That's what the patients were supplied in that study. So they were either consuming that or 30 grams of nuts a day. Most people I talk to, they seem to have a easier time with the nut consumption. I'll say if you're going to use oil as part of your diet, use olive oil. I mean, personally, I've tried to achieve those levels in the study, but I couldn't. So
Oh, that's a lot.
to get the perspective there of how much those nutrients were a part of the diet.
Thank you.
You're welcome.
Okay, is Aaron with us on Zoom? Can you unmute yourself and ask your question? Or you can type it in Facebook. Ann Luther had a question. I was told to chew aspirin if you think you're having a heart attack so it can work quickly. What do you say to that?
Yeah, if you're not on an aspirin on a daily basis, chewing an aspirin will get sort of therapeutic levels in your blood faster than just swallowing it.
Okay.
If
And
you
then
are
Ralph,
on aspirin, you already have levels of it in your bloodstream. But yeah, for people who
Okay.
take it every day, it's certainly worth doing.
Ralph McKenna asks, the whole food plant-based diet, and this is something that Mrs. Bash asked a moment ago, it suggests avoiding oils. You know, we get a lot of conflicting information. There's whole foods, there's,
Suggest avoiding oil, suggest avoiding saturated fats.
okay,
And that's bad. So saturated animal fat is probably not good. Olive oil, grapeseed oil, those are now thought to have a beneficial effect. But again, every advice that's very dogmatic when it comes to nutrition, be very suspicious of it.
okay. One more question. Well, we probably have time for 2 more if someone has a burning question, but this one is from Facebook. Aaron asks, if you have AFib, are the percentages higher of having a stroke or heart problems?
AFib is a risk factor for stroke, not
Okay.
necessarily a heart attack. Is an electrical heart condition that puts you at risk for a stroke. That's why most people with atrial fibrillation will be recommended to take a blood thinner.
Okay. Good questions, everybody. I'm so glad that you've taken advantage of our time with Dr. Paixao today. Does anyone else have a question? You can unmute yourself and let me know if I missed you. We're trying to get in we're on 2 different Facebook pages right now. We have 2 different LifeQuest Facebook pages and on Zoom. We are truly multi-platform. This is a free program open to the public because we want the message to get out in the education that you've provided today, Dr. Paixao. This heart hospital presentations are for February, which is Heart Month, for a variety of reasons. And Arkansas Heart Hospital will be with us 4 times this month at 10 on Zoom and on Facebook. So please come back next week. You'll be hearing from more guests. And we really appreciate everybody being here. If there are no more questions, I don't see any waving hands. I want to thank Dr. Paixao today. No more questions for coming. This was wonderful, and we appreciate you taking your time. You're saving lives every day through your education and your work at Arkansas Heart Hospital. Thank you so much for being with us. Y'all come back next week. And at noon today, we have a whole different set of health priorities to discuss. We're going to be with Dr. Lewis Crane on Facebook to talk about mental health, particularly mental memory and cognition. So join us on Facebook at noon today. Thank you, Doctor. Thank you, Vicki Wingfield at Arkansas Heart Hospital for coordinating. We appreciate you so much.